All right, welcome back. Martin Falls here with J.J. Buquet. Of course, he's president of Buquet Distributing Company, but he's representing the Chamber of Commerce. And I'll let J.J. go through the circle of introducing everybody again for you. J.J.?
Sure, Martin. Thanks again. Welcome, everybody. We're delighted to have you all with us this evening. To my left is Mr. Joe Harrison. I think I messed that up last time, Joe. Joe Harrison, currently serving as a state representative from District 51. And his challenger this evening, Mr. Howard J. Castay, Jr. Thank you, Howard, for being with us this evening. And our panel again is Mr. Ron Brooks with the Home and Terrebonne Chamber of Commerce. We have Mr. Tracy Tierney with TV22 out of Morgan City, and Mr. Philip McMahon with FLAG. So, folks, thank you all for being with us.
Yeah, Nikki Brewski, who's in our audience. She's not on the panel, but she is doing a report for the Houma Courier, and I'm sure that will be in tomorrow's newspaper. So, Nikki out there, welcome aboard. All right, what we're going to do now, we're going to go to our next question, which is by you, JJ.
Thank you.
You have the next one. Go ahead.
Appreciate it. Gentlemen, as you know, in this state, we're, like many states, we're hit with a pretty high unfunded liability. We have a lot of retirement systems for state employees that are dependent upon the Louisiana retirement system, not Social Security, as well as healthcare-related retirement costs. These are unfunded liabilities that are, I'm told, mounting to as much as $18 billion with a B for the state of Louisiana. A lot of debate about whether or not these are appropriate at the appropriate levels, how to fund them, whether they're deserving or not, and I'd like to throw that open for discussion from each of you, how you feel about this, how do you feel it ought to be funded, should there be cutbacks, should it be tax increases, how do we need to handle this?
Just for the audience to know that would be entitlement.
Entitlement, right.
This is something that's, I think, a hot-button issue across the United States for governments that are facing that. You saw what happened in Wisconsin, and we've been dealing with. The first year I was elected, I went back and I read all of the archives that refer to this particular problem, the unfunded accrued liability. We were looking at approximately $9.3 billion at that time. That's in '08. What we tried to do when I sat down and looked at the actuarial numbers of it, if every dollar that we put toward that unfunded liability, we'd have returned $4.65. That's when we had money. Unfortunately, it got shortchanged in the Senate, and we could have actually figured this out within a 10-year period to pay that out. But since then, it has grown to over $19 billion. And there is actually a law that's on the books right now that says we have to balance that budget by 2028, which, you know, you wonder, it just kept pushing it off, and made this just that much more of a bigger issue for us to deal with. $19 billion is just a number that's way past what we can do. But the state has actually shortchanged the system. So it's not the employees as much as it is the state not paying what they had to pay during that period of time. They deferred it 2 years forward, which is why we're facing this law. We need a stricter plan document because we have a number of plan documents right now that are different. We need a standardized plan document. We need something that's accurate, that we can put a plan together, solve this thing in the next 8 to 10 years, and I think that we can do that with good structured planning.
Okay, Mr. Castay.
Well, as an employer, I can't imagine telling an employee who is eligible for retirement that their reimbursement, I guess, or the years or the hard work that they put in is going to be cut. So having said that, I still think we need to get a clear picture of the entire budget. We still do not know exactly what the governor's office spends. He refuses to open his books up. I think, having also said that, we need to look at all of the state jobs, and when it comes to someone leaving because of death or perhaps they've moved on, that job should not be filled. I think attrition and cutting the budget by attrition needs to be heightened. That awareness needs to be heightened throughout state government, whether or not this particular job is necessary or not. I think that's an important question. Again, all of those funds will eventually add up. I don't think it's going to be an immediate answer, but I think it's a start.
Any follow-ups?
Yeah, I think that if you read the laws that we put in, because I co-authored a couple of them, we reduced the size of government. We have a law right now to reduce the size of government by 5,000 employees. We actually have 14,000 more employees today in the state per capita than we need. That's over $1 billion a year. So through attrition and some of the other things that we implemented, those plans, those programs, those bills and laws are in force right now. We just need to do what we haven't done many, many times, enforce the law. Do what's necessary, make things happen.
All right, Mr. Castay.
I think I just have to piggyback off of Mr. Harrison. The law needs to be enforced. Attrition needs to be enforced.
All right, I'll take the next question. It deals with health care. It's on everybody's mind. As a rep, both of you will be on the phone with congressmen and senators. Obamacare. Let's get right to the heart of it. Would you want to keep Obamacare, or would you want to repeal Obamacare? I'm not sure who's first on this one. I think it's Howard.
Well, I don't think anybody understands what Obamacare is right now, and I would think for that reason, until that there's a clearer explanation of what it is, I think a pause button needs to be put on Obamacare. I think the thing that we need to do is expand community health centers. I happen to be a board member of Tesh Action Clinic, which has a site here in Dulac. It also has one in Houma. Coming soon to Morgan City. We're also in the Franklin area of St. Mary Parish, as well as in Edgard and Reserve. There are over 8,000 community health centers in the United States today. Collectively, all of the community health centers save health care $24 billion a year. Why is that? Because we prevent excessive emergency room care. We also save hospital costs on specific type of patient care by a specific physician. And I think that's something that needs to be addressed.
Okay. Mr. Harris.
Absolutely against it, 100%. I have read through the bill numerous times and all the rewrites, and if you look at some of the pages that are in there, and I used to be able to recall those, when you're talking about hiring thousands of IRS agents who will go out into the public, primarily the employers, and look at the records, and if they have strayed off of the plan at all, they could lose their business, their personal assets, and actually go to jail. That's not the kind of government that I envision for the United States. I think that this is a personal issue. It's one that healthcare is for the people who want to look at the services that are the best for them. And they should have that right. That's a right that's given to us. That's not something the government should be involved in nor give to us. Let the free market do something. Let's curb costs. Let's reduce it where we can. And I think we can give and have delivered excellent health care. Otherwise, we wouldn't have all these people coming into the United States from other countries like Canada, Mexico, and Europe to take care of the health care needs that they have.
Okay. Each candidate gets a rebuttal on this, and it's a big issue. So if you want to elaborate, Mr. Castay.
Well, I think it's a shame that people are in this country today and they do not have health insurance. And again, the beauty of community health centers is that we see people on a sliding fee scale basis. So if you're in a very low income type bracket, you can still see a physician. You can still take advantage of pharmaceutical services. And we're really the best kept secret in the country because collectively, again, we're working to make sure everyone is receiving some sort of health care treatment. We've got to tackle the health care situation. We just can't ignore it.
If you look at our area, we have Thibodeau Regional, we have Terrebonne Regional Hospital, and we have Charity, which is the Chabert Hospital. The level of care here is excellent. They reach out to all areas of our society, from the lowest paid person or those people who are indigent and cannot afford it. We have taken care of them. This is going to dismantle the program as it sits today. It is going to hurt every single level of society that we have today. And I think that the state of Louisiana is one of the few states in the nation that has a charity hospital system. Why should we undermine a system that works for us and has not been established in the rest of this country?
All right. Thank you very much. And what we'll do now, We'll take another break. When we come back, we'll go back to the panel. 3 more questions. When we come back, don't go away.